Hi, and welcome to And So Much More on Centra's podcast. I am here with Dr. Christina Canzoneri, and she is a part of our plastics team. She does plastic and reconstructive surgery. And we're here because we have a patient, Erin Hagen. She's just going to share her story, her journey, starting with breast cancer, but also ending with breast reconstruction surgery. And I almost gave away your first surgery, but I'm going to let you say that. So we'll start with you. Introduce yourself. Tell us a little bit about yourself.
Yeah, my name is Erin Hagen. I have two little ones, a 9 and 6-year-old. Been living in Lynchburg now for 25 plus years.
Yeah.
So, yeah.
Makes you a local now.
It does make me a local. Yep.
And then Dr. Canzoneri, why don't you tell us a little bit about yourself and how you came to Centra?
Yeah, absolutely. So I don't know if I count as a Lynchburg native yet, but I've been here for a year. I started at Centra just last week was my 1-year anniversary. I'm so happy. Yeah, things have been going great so far. But I am from Texas originally and came to Virginia for the first time for my training, which I did plastic and reconstructive surgery residency in Carilion at Virginia Tech Carilion in Roanoke. So that's what brought me to the area. Stayed because I loved it here and I love taking care of patients in this kind of neck of the woods.
Yes.
So
well, we're so lucky to have you, especially because when you came, I feel like it breathed new life into our plastics program here, because now we can have conversations like this and patients have this at their disposal, which is so important, I think, not just for women, but specifically for women as we're talking about your story. And so you received a diagnosis how long ago?
It was right about a year ago. So
wow.
Early September 2024.
Okay. Yeah. So briefly tell us about that side of your journey, the cancer side of your journey.
Yeah. So as many 40-year-old women do, I started to get annual mammograms and something showed up on my annual mammogram. So fast forward several weeks and the diagnosis came back DCIS, which is ductal carcinoma in situ. Which I was very fortunate it was that diagnosis because it had not become invasive yet. And so once I received the diagnosis, as I assume most women in this journey will experience, you have a lot of appointments that you are going to. There's still a lot of imaging that happens. And then once you really know what it is you are dealing with, that's when the conversations with treatment begin and surgeries and reconstruction. And so I had met with my general surgeon here in Lynchburg. And we had made the decision for me to go ahead and move forward with a bilateral mastectomy. And so I think that was a Tuesday. And the very next day, I had a consultation with Dr. Canzoneri. And so you just receive a diagnosis. The bilateral mastectomy was my first surgical procedure ever. So that was a lot that I was trying to absorb. And then, you're being asked the very next day, do you want to do reconstruction? And so it's a lot of information and a lot of decisions in a very short amount of time. And so it was a lot to process, but you wanted to do it quickly because they wanted to, get the surgery started and see if there had to be any further treatment. So that's what led me to Dr. Canzoneri.
Wow. So much that I want to touch on that you just shared. First and foremost, please get your mammogram. Please get your mammogram. Start if you're 40. If you have family genetic history, go early. Find out what insurance covers. Get yourself hooked up with the Mam Van. If your insurance doesn't cover, there's details on our website. Please get your mammogram. So that's just a very important message. And I love that they found that. Yes. Was this your first mammogram?
No, this was my third mammogram, but I had never had a concerning one. And I do not have breast cancer in my family. They did do all the genetic testing after my diagnosis. So, I didn't have any genetic component to it. And so,
this was no reason for you
to go.
Really.
And actually the guidance I'd been given was because I hadn't had a concerning one, I could go every 5 years.
Oh, wow.
Thankfully I did not. Had I not, we would probably be in a different situation. Yeah.
So you mentioned that there were so many conversations, so many decisions that had to be made. What was that like? What was the support that you received? Tell me about that journey.
Yeah. So once we were really starting down this path, I was very thankful in that one of my good friends is a nurse navigator here at the Cancer Center. And so she was able to walk alongside me and really explain everything, no different than how I assume they do with any patient that is brought to them. So right off the bat, that was a huge blessing in just helping me understand what I was going to be facing, some of the decisions I had to make, but also encouraging me to get different consultations, staying local, maybe UVA or Duke. And so all of that, we were really trying to work through quickly because we knew we needed to have the surgery, but who was going to do the surgery, right, was the biggest thing. And so after we decided to stay local, I'll be honest, the decision for the mastectomy was probably the easiest for me. That was, yep, if that's going to reduce my risk, go for it. It was actually the reconstruction piece, because I'm like, man, I don't want more surgeries. Do I want to go through it? And so that's where I really struggled the most, I think, to work through all the information and really make a decision there. But once again, getting to sit with Dr. Canzoneri and have her walk it through with me was unbelievable.
So I'm sure it's different for every patient. Absolutely. But tell me a little bit about that conversation that you have when a woman comes in, and in your case, it's the day after. And so there's a lot of emotions that are happening. That's a lot on your plate. So you're more than just a provider here. You are having to really, step in and provide that clarity and that comfort. So tell me about that conversation.
It's a big conversation. Yeah, I know that, Erin, I'm sure you remember this. I tell people it's okay to be emotional during this visit. You're going through a lot. And it's so true what you're saying, that when you're thinking about needing surgery to reduce your risk, to cure your cancer, that's an easy choice, right? It's pretty laid out for you that this is what we need to do for your overall health status. But when making the decision about breast reconstruction, which is, really considered an elective procedure, right? It's not cosmetic, it is reconstructive, it is covered by insurance, but it is elective. It's not necessary for your overall health. That can be a really big choice. The visit itself, we always block off at least an hour for that conversation because it's a big conversation to have. And it is such a good, I'm so glad you brought your husband to that visit, because it is great to have an emotional support person there with you, but it's also great to have somebody who can just help you remember the information. Because
that's a great point.
I feel so bad for these women, obviously because of their recent diagnoses and what they're going through, but also because I essentially talk at them for about 45 minutes about what breast reconstruction is, how long the process takes, what their options are that are, it's really different for every woman based off of her diagnosis, based off of her imaging, her overall body habitus, whether she needs radiation. So there's a lot of factors that go into it, and it can be a lot of information to retain. So it's a big visit. The good news is, though, that after that initial conversation, if we do move forward with surgery, there is a second visit before any surgery takes place so that we can go over all your questions and concerns again and just kind of neatly tie that all up in a little bit a bow before the morning of surgery. So
what are some of the most common misconceptions or fears or questions that are brought to you in either one of those meetings?
Yeah, absolutely. Well, I think that there are a lot of things that I just say right off the bat for every single patient to try to address some of those misconceptions or fears. A lot of women are concerned just about paying for it. Will insurance cover this? And so I like to tell everybody up front, once you've had a mastectomy, insurance is actually required federally to pay for any reconstructive procedure on the breast that has been removed, but also on the other breast if it needs to be changed in some way, if it needs to be reduced in size or augmented in size with an implant, your insurance will cover that as well. So that's a big thing that we cover on that first day. But also that, there's no rush to this. If somebody wants to decide to just move forward with a mastectomy first, heal from that, and then consider to, continue to consider their options, that's certainly something that we can start reconstruction in a delayed fashion, where maybe 3-6 months down the line, we can focus on starting the reconstructive process. So I really think it's such an individualized thing based off of each individual patient that really, if you have any questions about reconstruction, just come in and I will break down based off of all of your individual patient factors, really what you would even be a candidate for.
Yeah. I was going to ask you, what goes into that decision making, but that really kind of sheds a lot of light. First of all, I did not know that insurance covers this. And so that just goes to show you how important it is to just have the conversation, just ask the question. Let's not go in with a preconceived no when the answer could be yes. And so I do want to touch on just that surgery experience. And so, because like you said, this was your first surgery, and for a lot of women, having big surgeries in our life is not a very common thing. And so what is that experience like?
For me, there was a lot of anxiety around it, not because of the procedure I was having, or I even think what the recovery was going to look like. It was, I think, just the experience in general, having never been put under general anesthesia before. That was terrifying for me. And I don't know why. And so, from the moment I stepped into Virginia Baptist, the nurses were fantastic. Dr. Canzoneri comes and meets with you. My general surgeon came and met with me, and the anesthesiologist, and they just took the time to walk back through. Okay, here's what we're doing. Here's kind of the process and the length of it. Of course, my husband was there the whole time as well. And then it's just one of those where they wheel you back and you don't remember a whole lot after that part, which is the fantastic part. Thankfully I reacted very well to the anesthesia. I didn't have any adverse side effects, which once again was my major concern. But with the bilateral mastectomy, I did stay a night in the hospital. So just so I could be monitored. And then that next day, bright and early, Dr. Canzoneri was there making sure everything looked great. And then you're sent home for recovery. So.
And how long was recovery for you?
I would say, I had surgical drains. And so I had those a little over 2 weeks of when I was able to get those drains out. So those first 2 weeks, you're very limited in being able to move. You don't want to overdo it because you really want those drains out as quickly as possible, as I was telling Dr. Canzoneri, I think every time I met with her. But you have a lot of follow-up appointments too, which is one of the reasons I was so thankful that I chose to stay local. Because my house is 5 minutes away from Dr. Canzoneri's office. And so if I had a concern or if it was just a checkup, I was here. I wasn't driving 2 hours. So that part was great. I would say by a month, I was released to start doing some lower body exercises and, stuff like that, and starting to get back into the swing of things.
Yeah. So what is this like from the clinical side?
We get to know our patients really well, I would say. And so, this is one of my favorite things to do within my field of practice, is to help take care of my patients with breast cancer, just because we do form such a relationship during the process. So, for many women who choose to undergo implant-based breast reconstruction, that's at least 2 surgeries. And in between the 2 surgeries, you have tissue expanders, and those have to be filled periodically in the office. So you're coming in every 2 to 3 weeks to see us and our team and our nurse practitioner, Courtney. And so we get to know you really well, whether you want to or not. We're going to be friends at the end of this. And so, I think from a clinical standpoint, I love doing this just because we do get to form that relationship and kind of see you from start to finish. And it can be such an emotional journey, particularly at the end, even when I say, well, it's been great treating you. Yeah. See you around. Wait, I just leave now?
Yeah.
Wow. It's a season. It's a season of your life that is really so drastically different, kind of, a little pocket in the middle. But what I love and what has been so encouraging to hear from both of you is that care team that has come around you, that changes everything. It changes everything, especially when it's your first experience, when there's family, when there's just so much that goes into it. So understanding that care team approach that, I think most facilities would do. How many people were on a care team for Erin, but for any given patient?
Oh gosh, a lot. Well, just from, the plastic surgery standpoint, you have kind of a whole team around you because it's, I mean, you're going to see me, you're going to see our nurse practitioner who does a lot of the tissue expander fills, but certainly you're interacting with lots of people in our office, from nurses and surgery schedulers. But then certainly there's general surgeries involved. Usually medical oncology, will have an appointment with them. For many women, radiation oncology is required if you require radiation following your treatment. Genetics, all the staff at the hospital. It ends up being just an incredible number of doctors' visits. And
you touch so many different areas within Centra. And you mentioned your nurse navigator too, who I imagine is extremely helpful in figuring out paths to take and what areas you are going to be interacting with.
Yeah, I mean, even the radiologist who read my mammogram, and they're the ones who did my biopsy as well. I mean, there were so many different departments and individuals who were part of my care team. So
1 year later, you're celebrating your first full year here at Centra, but you're celebrating the year of this kind of coming to, I don't want to say to an end, but, coming to a close in the season. What are things like now? Post-recovery, how has this impacted your life?
Yeah, well, I actually had my second surgery. So that was when they took the tissue expanders out, put the implants in. So that was February. So it was probably right around 3 months after my mastectomy. And so you have to go through that recovery a little bit again. And then I think I had my last appointment with Dr. Canzoneri, I want to say it was sometime in May, and that's when she kind of gave the, hey, it's been great, go live life, I'm not an emotional person, but I teared up because I'm like, man, I've had so many appointments, like, what do you mean go live life? But it's been great. I've had no complications. I've been very happy, not only with the care that I received, but the results as well. I think once again, you're always, is it gonna be weird? Is it gonna feel different? Is it gonna look different? And I can only say positive things about my experience, specifically with Dr. Canzoneri. And I'll give one example if I can. Being wheeled into the second surgery, there's a ton of people in the operating room, right? And I think they tried to introduce you to everybody, but you've already been given something to where you're feeling very relaxed. And I'm like, I don't know, I'm not going to remember this. But I remember Dr. Canzoneri was right there, the nurse practitioner was right there, and they held my hand. I think Courtney held my toe, and and they're just, okay, Erin, here we go. Like, they're putting the stuff in, we're going to see you on the other side. And I mean, I woke up and they were right there. Wow. And I'm like, just to have them there, that was huge. Yeah. That was a huge blessing.
That is amazing.
Yeah.
So I want to hear from both of you on this last question, but what would your message be as a patient, as a survivor at this point, to women who are watching this, maybe in your shoes at the beginning, or maybe at the end, kind of like you are, and are like, what do you mean just go live my life now?
Kind of what you emphasized at the beginning, don't miss your annual mammogram. I'm so thankful that I did not miss mine, because it would have been a different story. So I just encourage everyone to be consistent with that. But ask questions. It's your health, it's your body. Ask questions, even if sometimes it's awkward and you feel like you might be offending the surgeon, or ask those questions, because at the end of the day, you just want to have a peace with the operation and I guess the direction that you're choosing to go. And I know this sounds cliche, trust the process. It can be a long process and sometimes a frustrating process. And thankfully, Dr. Canzoneri let me call and email, and is this normal? Can I send you a picture? Because I don't think, and she always took the time to explain, Erin, it's normal. All of this is normal. And so that was always just a huge, huge help and blessing for me.
I love it.
Yeah, I mean, I definitely want to echo your message, especially as October is approaching with Breast Cancer Awareness Month. Please get your mammograms. It's so, so, so important. But, certainly once you've got a diagnosis, just come talk to us in plastic surgery. I and also Dr. Jessie Payton, one of my colleagues, we both do breast reconstruction here, and we are so open and we're easy to talk to, and we want to talk to you about all the options that are possible, whether that's something that we can accomplish for you here. Maybe you better be served by some kind of autologous option that, we can't do here, but we know all the people in the area who are really good at it, and we can help guide you on your path, whichever path that may be. And maybe the answer is no reconstruction at all, and that's okay too. And, we can still be here, thinking about you and supporting you spiritually or however through your process. But come talk to us, because any questions that you have about breast reconstruction, we are more than happy to answer.
Awesome. Thank you both for just being transparent and so kind, sharing your story, and then for giving us so much context into that snapshot of what it looks like from a clinical perspective. For those of you who do have questions, again, head to our website. You can go to the plastics page, and we also have our cancer page, which has so many details. But then reach out to your provider and just start a conversation. So thank you guys.
Thank you.
And thank you all for joining us for And So Much More.